Hello and welcome. Today we're diving into a rare but significant eye condition called Coates' disease. It's a disorder that primarily affects young children and can lead to vision loss if left untreated. Join us as we explore what Coates' disease is, what causes it, how it's diagnosed and treated, and what the future holds for those affected. The exact cause of Coates' disease remains somewhat of a mystery. It's considered idiopathic, meaning its origin is unknown. However, we do know that it's not typically inherited or caused by any external factors like injury or infection. Current research suggests it arises spontaneously, possibly due to genetic mutations occurring during the development of the retinal blood vessels. At its core, Coates' disease is a vascular disorder affecting the retina, the light-sensitive tissue at the back of the eye. The blood vessels in the retina, for reasons we're still trying to fully understand, develop abnormally. These abnormal vessels become leaky, allowing fluid and lipids to seep out into the retina. This leakage leads to swelling, detachment of the retina, and eventually, if untreated, permanent damage to the eye. Coates' disease is a relatively rare condition, affecting an estimated 1 in 100,000 individuals. It usually presents in childhood, most commonly between the ages of 6 and 8. While it can affect individuals of any ethnicity, it's slightly more prevalent in males. Interestingly, Coates' disease usually affects only one eye, making it a unilateral condition in most cases. The signs and symptoms of Coates' disease can vary depending on the severity and progression of the disease. In the early stages, you may not notice any symptoms at all. However, as the disease progresses, common symptoms include leukocoria, which is a white or yellowish reflection from the pupil, strabismus or crossed eyes, blurred vision, decreased vision, and in severe cases, pain and redness in the eye. Diagnosing Coates' disease requires a thorough eye examination by an ophthalmologist. This typically involves dilating the pupils to get a clear view of the retina. Special imaging techniques like fluorescein angiography and optical coherence tomography, or OCT, are crucial for confirming the diagnosis and assessing the extent of the retinal abnormalities. Fluorescein angiography involves injecting a dye into the bloodstream and taking pictures of the retina to visualize the leaky blood vessels. OCT provides detailed cross-sectional images of the retina, allowing doctors to assess the fluid accumulation and retinal detachment. Coates' disease is often classified into stages based on the severity of the retinal changes. These stages range from mild cases with minimal leakage to severe cases with total retinal detachment. The staging helps guide treatment decisions and provides a framework for monitoring disease progression. The specific classification system may vary slightly between ophthalmologists, but the underlying principle remains the same: to categorize the disease based on its clinical presentation. The primary goal of treatment is to stop the leakage from the abnormal blood vessels and prevent further vision loss. The most common treatments include laser photocoagulation and cryotherapy. Laser photocoagulation uses a laser to seal off the leaking blood vessels, while cryotherapy involves freezing the abnormal vessels to destroy them. In more advanced cases, surgery may be necessary to reattach the retina. Anti-VEGF injections, medications that target a protein involved in blood vessel growth, may also be used to reduce leakage and swelling. Regular follow-up appointments are crucial to monitor the effectiveness of the treatment and adjust the plan as needed. Unfortunately, there's currently no known way to prevent Coates' disease, given that it's believed to arise spontaneously. Early detection through regular eye exams, especially for children, is the best approach to minimizing potential vision loss. If any unusual changes in vision or eye appearance are noticed, it's essential to seek prompt medical attention. The prognosis for Coates' disease varies depending on the stage at diagnosis and the effectiveness of the treatment. Early detection and prompt treatment can significantly improve the chances of preserving vision. However, in advanced cases, vision loss may be irreversible. Ongoing research is focused on identifying the genetic factors involved in Coates' disease and developing more effective treatments. Gene therapy and targeted drug therapies hold promise for the future, potentially offering new ways to prevent and treat this challenging condition.